Hello friends, hello friends, hello friends, hello friends, hello friends, and welcome to the Union Labor Advisory Network. I'm Mike Fina. ULA's mission and vision is to support, educate, and promote union labor in our communities. There are great careers that you could have within the building trades as well as public sector unions. We're here to shed light on those opportunities, what they're doing, what these jobs are all about, and highlight them across the ULA's platform. We're going live now. All right. 5, 4, 3, 2, 1. Hello friends and welcome to the Union Labor Advisory Network. I'm Mike Fina. Today I'm extremely proud and privileged to be with Tyler Lefeber who is the Director of Labor and Trust for Sales for Color Health with us today to learn a little bit more about his background, history, and experience. I know Tyler for quite some time right now, working the market and labor, but excited to have you on, Tyler. So thank you so much for being here, and excited to have you share your background with the audience today.
Mike, it's great to be here. Thank you for inviting me. I mean, supporting ULA, the mission could not be more aligned with what we're doing at Color, educate, some more support and promote in labor. That's exactly what we're doing in cancer. So again, thanks for having me today.
Without a doubt. Now, how long have you been in the business right now? And I know you've been working with Color. So just give us a little elaborate about your background and how you're covering the whole United States or the specific territory that you're working with today?
Yeah, so worked with labor for many years, been at Color now about 3 years. Primarily, I'm based here in New York, but working nationally, along with a couple counterparts. I think really what we're doing, at Color is there's a unique opportunity in labor because folks are behind on cancer screening, right? They're behind on understanding, as everyone across the country is understanding what they should be getting screened for. So our program, I think what I've found, it's really solving a unique challenge and issue that is particularly afflicting labor. So cover the whole country, but, primarily working with folks, Northeast, Midwest, and out West.
Yeah, I've seen it everywhere. You're going to all the conferences, you're at the trade shows, you're definitely relevant and out there, promoting the cause. So it's great to see you again.
Always on the road.
Exactly. Tyler, could you give us a little bit an overview, like how does cancer impact union members? And I know there's a disproportionate impact on union members versus the general population. And what factors do you believe contribute to this?
Absolutely. I mean, unfortunately, cancer is more prevalent in union members compared to the general population. One reason, as many people know, is the prolonged exposure to hazardous materials. Across many of the trades, we see this. Asbestos in construction, chemicals in manufacturing, and unfortunately, this exposure went unchecked for far too long. And we certainly have labor to thank for all the progress we've made, in occupational health and safety. And then many members work in high stress environments or have shift work that disrupts normal sleep patterns. There's also studies that show that this can contribute to higher cancer rates as well. All of these factors really strengthen the need, for regular testing. And unfortunately, too many union members just aren't getting checked out at all or as often as they should be. And again, a lot of that is people just don't know what they should be getting screened for, right? Guidelines change. Union members are working really long hours. It's a challenge to prioritize getting screened, right, with those shifts. And if they are going to prioritize, it's typically their family, right? And, you take lung cancer, for example, lots of folks in labor smoke, but only 6% of folks are up to date on their lung CT scans. Most people don't even know that lung CT scans exist, right? So just by educating folks, getting them up to guidelines and helping them detect cancer early, right? This is what starts to move the needle pretty significantly.
Yeah, again, you're screening for a lot of different types of cancers. What are some of the most prevalent among union members that you see today?
Yeah, so definitely. I mean, skin cancer and mesothelioma are notably higher, often due to, exposure to UV rays, asbestos, without those sufficient protective measures I mentioned earlier. There's also higher rates of leukemia and lymphoma, again, which are often tied to the chemical exposure that they handle on the job. And again, I mean, these increases, I mean, it just further highlights the need to educate members and make them aware of their risk. Just that starting point of what is your risk of getting cancer. And then, of course, making sure that they actually can take action, right, to get screened and get the care that they need.
So, Tyler, what options do union members have to address cancer more effectively?
Yeah, I mean, first thing for union leaders, right, when they're actually thinking about how to address, you have to take a stance on cancer, right? There's not a lot going on right now outside of the health plan, sending a postcard on your birthday, to get your colonoscopy or whatnot. But cancer is number two driver of high cost claims for almost every single fund that I talk to. Costs are exploding. They're out of control. Late stage diagnosis is on the rise, right? And I think union leaders have really started to take notice that the current system isn't working and members just aren't getting the care that they need. So it's really about recognizing that cancer care doesn't stop and start with diagnosis, right? Managing someone with an active diagnosis, they come to you, you're going to provide support, but it doesn't start and stop, right, at that point, right? When you're just focusing on, the episode of cancer, your members really aren't getting the outcomes that they're looking for, right? Both in surviving cancer as well as the cost savings as well. And we know cancer treatment can leave people in financial ruin. So we need to think about it holistically. We need to catch it earlier, right? We have to educate members and their families on their risk and then get them the support that they need, right? All the way through recovery, when they beat it, survivorship, getting them back to work. And I think in my conversations, I believe funds, want to take this type of action, and it's important that to implement a strategy that is focusing on this full spectrum of cancer.
Yeah, and Tyler, I know we kind of jumped into a lot of it, but for those who are unfamiliar with color, could in the program for labor unions, can you elaborate a little bit more about that and your partnership or your relationship with the American Cancer Society as well?
Absolutely. I mean, what's exciting about this partnership is it's first of its kind, right? American Cancer Society, they've been around for 100 years. They're a household name. They're a leading cancer organization, educating people about cancer and supporting them throughout the journey, right? From education all the way through beating the disease. But the thing is with ACS is they don't actually deliver healthcare. So this is the first time they partnered with a company to actually deliver on all of this amazing work that they've been doing for the last century. And that's where color comes in, right? So our virtual cancer clinic, what we're doing is providing earlier intervention, cancer care, transitional assistance, survivorship support to members. And it's about focusing on these three stages in equal measure to actually drive impact for unions. And that's detecting it early. It's managing the active diagnosis appropriately and then supporting survivors. And when you think about this approach holistically, you're 4xing, a member's 5-year survival plan. You're saving on average more than $250,000 per case. And again, when you're thinking about these out of control costs, that's how you start to actually tackle this complex issue, which is cancer. And I mean, how we're doing it, right? You have to meet the member where they are. I think this is what I hear time and time again with reasons why programs don't work, with these funds is you have to show up where they are, where they're living their life, whether that's, at home, on the job site, at the health fair, at the golf outing, truly wherever. And, some cancers like prostate, colorectal, cervical, they all have at-home tests, right? Ship it right to the home with a return label, pop it in the mail, and they're good to go, right? And then you have to then remove all the burdens of in-person screening by scheduling, rescheduling, staying on top of the members to manage all these appointments and follow-ups. We know what the system today looks like, and it's so challenging, right? To get the appointment, get the referral. So you need someone that's going to help take some of that off their shoulders. And then as you start to move through, when there are results that need to be managed, engaging with members to make sure they're ordered, they're completing the additional diagnostic testing, all these things that come as someone moves through, the journey, and making sure all of this is done, at a less expensive than what they're doing through the plan today, which we find is about 30 to 50% less expensive than what you would get through your carrier today.
Wow, and a lot of the stuff that you've discussed today, like what's different about Color's program that helps address some of these gaps that you talked about?
Yeah, I mean, I like to use the example of Teamsters Philly and Vicinity. We've been working with them now for many years. This fund, mostly truck drivers on the road constantly, very limited time to, prioritize preventive care. And if they are, they're focused on their families and their children, most often. And we know cancer cases were rising, members weren't getting screened, all of these trends I'm seeing across the board. They had about 4% participation in their health fair. And that's not for lack of effort on the fund side. They have been such a leader in providing innovative and fresh benefits for members. But the fund, they liked our approach, but again, the concern was, is anyone going to use this? So how are you actually going to do things differently? And we knew that, if you catch one cancer early, obviously you're saving that person's life, but you're starting to actually drive that significant savings. That's, of course, paying for the program, but then starting to compound, right? So we showed up everywhere, Mike. I mean, we were at their health fair, job sites. I think they had about, 10 different employer shops. We showed up at each employer shop. We attached incentives. We engaged the stewards and trained them up on the program. So it kind of becomes that teach the teacher mentality. Gift card, right? When you return the screen, you get a $5 Wawa gift card. That was incredibly effective. And by doing that, we had 20% of their entire population. So 5x the number of people that actually engaged in preventive care, right? And when you get that many people through the funnel, right, then you start to find those folks that are high risk that didn't even know they were high risk. We certainly caught a couple early stage cancers for people that didn't even know they were at risk for these types of cancers, right? And it's all about helping people be more proactive about their health. And, if members aren't on the job site, they're not making money, right? We're having a very different conversation, right? When you detect cancer at stage 1 versus stage 4, right? The health outcomes, the cost savings in their families, it's incredibly significant. And we're here to help, make that impact.
So, yeah, Tyler, I mean, again, we talked about it before, seeing you at all these relevant events, educating the market on these particular service offerings to help be more preventative maintenance and getting ahead of the curve. Cancer is a scary word. I mean, it's just very, very scary, and people are afraid to even sometimes take those tests. Like you're almost like I got this cough. I'm not sure what's going on, but it's you need to do this. Hats off to a lot of the benefit funds that are out there looking at alternative ways to help reduce or help their members with better access to service and care, especially on the preventative side, because that's where the world is today. You have all these technology, tools and offerings, but they're more on the preventative side because if you get it up, the stage 1 versus 4, there's a better chance for a survival rate and just having a better, obviously quality of life and service offering to the membership sizes that you deal with today. So you're doing great work.
I mean, there's a lot of stigma attached to cancer, right? And I have not been in a trustee meeting where either one of the trustees or a close family member was not impacted by cancer, right? And so I think by making this, demystifying it, making it more accessible, less scary, we say the best test is the one to get done, right? They might need to get their colonoscopy, but they're not going to do that. So they'll take an at-home FIT test, right? Or your Cologuard. And that might be just what they need to do to start taking action. And we just want to help propel people forward and get them engaged in a way that doesn't feel fearful, right? And again, just makes people motivated to be proactive about the very serious, condition, which is cancer.
Right. And so, Tyler, you're out there in the field. You work with a lot of the different, health plans. So you integrate your services into the health plans that are there currently. Or how does it work? Someone's interested in getting in touch with you and learning more about your services and how they would integrate that into a benefit plan for labor.
Yeah. So we certainly, integrate with the health plans. We are a trusted alliance member for the Blue Cross Blue Shield Association, the National Labor Office.
Mm-hmm.
Their job, the health plan, is really looking to find new and innovative ways that are labor friendly and clinically validated, that are an extension, right, of the work that the health plan is already doing. So everything that we're doing is covered under guidelines, right? We're following American Cancer Society guidelines. So everything is 100% covered in the plan, right? So these aren't additive, right? These are more cost-effective more cost-effective ways of getting the screening that you should already be getting screened. So that's when you start to think about, there's not, an incremental cost to the fund, because we're delivering the screening at a lower cost and we're catching it early, which is something that the current health system today struggles to do, right? If we catch cancer early, that's better for the member, of course. It's better for the fund. It's better for the health plan. It's better for everyone involved, right? And so I say, I know you have my contact information here for anyone that wants to reach out, but that's the conversation we're having, because this is not an isolated incident. Every single union is seeing this across, certainly in the top three, and I'm finding it number one and number two in nearly every conversation I'm having.
Yeah. So yeah, these are big cost drivers on the benefit fund. Big, obviously like you said, the top three. So we need to be, aware of all these particular programs to help reduce those, the problems that may incur, as well as some of the costs that are occurring on the fund as well. And, I just want to appreciate and thank you for all that you're doing to educate the market on these particular services and everything Color's doing as well. Again, just proud to know you, be affiliated with you, and have your support, and follow that mission for the ULA networks to support, educate, promote union labor in our community. So I'm thankful to you, Tyler, and Color.
Likewise, Mike. I truly appreciate the partnership and the work we've done and the work we're doing the rest of this year and next year. So much we can do together, so many ways we can support these funds.
Absolutely. It's all about education and supporting the members, and that's what you guys are doing. So, again, hats off to you. We'll have all the information, your contact information on, in the context as we get this message out. And just want to thank you again for all you're doing. And I'm sure we'll see each other at the next conference or event, in the coming weeks and months.
Absolutely. Thanks, Mike.
You got it, Tyler. Take care. I'd like to thank all our sponsors for helping to build and promote the ULA network. It is because of you that we're able to support, educate, and promote informative content relative to labor. Please subscribe, like, and share our channel and media. I'd like to thank you all for your support.